Neo-Malthusians believe that the world will become overpopulated because resources like food grow linearly, but the population will grow geometrically. This will happen in many countries, and therefore there will be overpopulation that will cause billions of people to desperately search for food and energy. Currently, these billions of people live in different countries in different epidemiological stages. Different characteristics of these stages affect everyday life for people in different parts of the world. Stage 2 is the stage of receding pandemics, which are diseases that occur over a wide geographic area and affect a very high portion of the population. Nigeria is one of the countries that is currently in Stage 2. Its CBR is 40.52 births per thousand, and its CDR is 12.11 deaths per thousand, and its NIR is 26.05 people per thousand. Nigeria's DTM in Stage 2 shows high population growth and low birth and death rates. The DTM corresponds with typical characteristics of Stage 2, where Nigeria currently has many infectious diseases. Some of these infectious diseases include HIV and AIDS, which affects 10 through 99 people per thousand living in this country, while the other disease is cholera, which became an especially virulent epidemic in urban areas during the Industrial Revolution. Other diseases include malaria, infections, stroke, and stroke neonatal disorders. The healthcare expenditures per capita in Nigeria is below $100. Government expenditure on health as a percentage of total government expenditures is 5.0 through 8.9. The number of hospital beds per 10,000 people is below 10, and the total number of physicians per 10,000 people is below 50. Private expenditure as a percent of total expenditure on health is 60 and above. Malthusian population theory was made as a result of rapid population growth. However, this theory is manifesting in Nigeria as a cause of rapid population growth rate, large poverty, food crisis, and HIV and AIDS epidemics. Many people there don't have necessary food sourcing, with around 500 to 999 people per square kilometer of arable land. Compared with more developed countries like the US, it's expected to double in the next 27 years. Stage 3 is the stage of degenerative and human-created diseases such as cardiovascular diseases and cancer. There is a decrease in deaths from infectious diseases in Stage 3 countries, but an increase in chronic disorders associated with aging. This relates with the declining death rate in DTM Stage 3 countries because of the better healthcare. The number of children is also going down because most kids do not die because of better healthcare. This means that the NIR is decreasing because the better healthcare leading to less kids and less early death. In Chile, there's one physician for every 1,000 people in the country, 2.1 hospital beds per person as well, and a person gets $300 to $999 for healthcare. Stage 4 is the stage of delayed degenerative diseases. Cancers and cardiovascular diseases are still found, but their spread can be slowed with modern medicine. In some cases, with the proper operations or medicine, these diseases and cancers can be completely cured or removed. More advanced medicine and medical practices also result in higher life expectancy. More people tend to live healthier lifestyles that incorporate healthier diets, more exercise, and less use of tobacco and alcohol. The United Kingdom is an example of a country that fits the Stage 4 criteria previously stated. It meets the medical development criteria, has a steady population growth rate along with a steady birth rate and a low death rate. In the United Kingdom, there are 2.8 physicians per 1,000 people and 2.61 hospital beds per person. The United Kingdom spends about $3,700 per person on healthcare in a year, which is about 9.6% of their GDP. Stage 5 is a reemergence of infectious parasitic diseases, meaning that the infectious diseases that were thought to have been eradicated have come back, and new diseases have emerged as well. This causes higher CDR in the country. This relates to the DTM Stage 5 because in Stage 5 there is a decline in population that is caused by an increase in death rate. For example, healthcare expenditures per capita in Japan are $1,000 and above. Government expenditure on health as a percentage of total government expenditures is 13.0 and above. Hospital beds per 10,000 people in Japan are 50 and above. Physicians per 10,000 people are 50 through 149. And private expenditure as a percent of total expenditure on health is below 20.